Hi, well, good morning, everyone. Thank you very much for coming today, and apologies for my voice. I'm a little cold here, but I'm very honored to be here with all of you and be joined with my sisters here, my sisters Nasima and Jhoselyn. Our bios are up there. I'm not sure if it's very clear to see, but I'm from Islamic Leadership Institute of America. We do youth development leadership training for ages 9 through 28. We have some programs for teachers and for parents. Sister Nasima, I'd like to introduce yourself and Jhoselyn, and then we'll to Jhoselyn.
Okay, I am from the Maryland African Family Support Committee. We are now joined with a nonprofit organization called Pillars for Humanity. And we are working in the resettlement space now. We've been here for the past year and a half or so, working just to help in the gap between the services that has happened with the sudden influx of refugees from Afghanistan. But our focus is to help refugees of all backgrounds in society, Africans of all backgrounds.
Hi everybody, my name is Jhoselyn Rodriguez and I'm the founder of Coaching Salud Holistica. It is a consulting company that provides education services, primarily in English and Spanish. We're currently based out of Montgomery County, but we do a lot of work within the Prince George's County and we continue forward to other counties. Most of our audience is parents, teen moms or teen parents, as well as the Latino, immigrant, and newcomer population. So looking forward to discussing a little bit more about the work that we do within our community, but nonetheless, I guess we can go ahead.
All right, so we're going to do it as a panel discussion style, and we'd like it to be as interactive as possible, so feel free to ask questions. The topic is unique needs for immigrants and refugees in America. The QR code at the top, if you scan it, you can get your contact, email, literature, and stuff later as we speak. So we'll start maybe talking about some of the challenges that we have come across when it comes to refugees and immigrants in general. Maybe if you want to switch over with me in a couple of minutes, we can switch over here. So I'll present the question to our panelists and then I'll go after maybe. I will start with Sister Jhoselyn. Can you share maybe some of the challenges you've experienced working with, I know you work mainly with Latino community, so some of the challenges you've seen with refugees and immigrants, if there's any differences.
Yeah, I would definitely say that, a lot of the work that I do revolves around access to healthcare and just health education. So one of the biggest barriers that I've seen within the community is just having access to insurance. If they don't qualify, then it's community clinics. A lot of the time as a community health worker, I've seen, we're scheduling patients sometimes. They don't get appointments until 4 months, 6 months out. And it's very much a concern because, sometimes we'll have individuals who might be coming from another country with diabetes, hypertension, things that are chronic conditions that need medical attention more regularly. Or if they are being discharged from the hospital, they need to see a PCP. And unfortunately, the community clinics are just maxed out from my experience. It's definitely been something frustrating. It's just a lack of, I would say, maybe funding in terms of putting into the health centers or not enough staff. Overall, there is a big gap in terms of access to healthcare resources. And that is just primary care. That's not even getting into the specialties, The other barrier I did want to comment on was access to prenatal care services. A lot of the communities that I've worked with, both immigrant and refugees, are looking to access prenatal care, but they might be late term. So they might be in their second to third trimester. And most providers, especially if they're uninsured, they do not want to take on the patient because they are high risk. So then we have moms going without prenatal care, without the education of it. That's not even tying into the language barriers and everything else that might come with it. And of course, we know that something that I commonly say is that the U.S. is number one in a lot of things, and unfortunately, it's just the number of mortality and morbidity rates of our maternity population. So I would say that's a lot of the space that I work in. It's just bridging that gap in education and improving health understanding.
So just to piggyback on that, you mentioned healthcare, and I do know that part of the problem is just maneuvering the system, figuring out how to get started. Any advice you have for service providers who work with immigrants or refugees, like how to direct their clients where to start?
Yeah, thank you so much. It's that's definitely one of the things that we do is we love to do how do you access healthcare resources in your county, and we do those workshops regularly with schools, churches, and different groups. We'll first start off with Medicaid, Medicare, what is that, how do you access it, and then move our way into the services that are available at low cost and free for those who are uninsured, or even just discussing the county program. So that is definitely one approach. Just something as simple as that. We know that health fairs do a lot of great work, but I think just really sitting down and just kind of walking through and kind of hand-holding our population with the process definitely can go a long way, as well as community health workers. I can talk all day about it, but community health workers are pillars of our healthcare system. And most of the time, our community health workers identify with the communities we're trying to serve. So using community health workers who identify with those communities, who live, who eat, and go to church with all of those communities we're trying to serve, and giving them the tools to spread the word about how you access healthcare resources can definitely go a long way. So nonetheless, I think that would be my best advice and what I've seen successful, that I'll definitely close there. Yeah.
Well, thank you for sharing that. So show of hands, how many people here participate in health fairs, for example? Okay, just a couple. So maybe that could be one thing. So in summary, workshops
Yes.
that nonprofits will do, health fairs for community workers, those are three main methods to kind of help people participate with the system and navigate the system. All right, Sister Nasima, you work well with refugees and immigrants. So maybe you can share with us some of the challenges you've come across in situation.
Okay. Look at my notes here. But basically, if I go to medical, well, let me start with the definition of a refugee. A refugee is somebody who, according to the UNHCR, is someone who is forced to flee their country because of persecution, violence, or war. And because of that, their situation is a bit different than the immigrant in that they didn't plan for it, or they were under such stressful conditions they couldn't prepare enough. So they have lost some part of their support network. They don't have all the things that they thought they would have when they immigrated. The way immigrants are able to bring everything they need, or at least have some sort of plan in mind. So, given the suddenness of the situation and the background from which they're coming from, you can identify 5 areas where the medical need of the refugee is slightly different. And number 1 on that is the prior condition. What condition were they in before they came? Are they coming from a refugee camp? Oftentimes, or war. In both situations, you have undernourishment. They might be coming with a weakened immune system. They may have special diseases that we don't see here. The incidence here is low because of our vaccination and health system being good enough. So these are things that you have to keep in mind. The next thing would be mental health. And there are some mental health diagnoses which can be mimicked by stress. So a person could just have stress from their very stressful situation, and the provider may not be able to differentiate between that. Training is required for that. However, for every one doctor or provider who gets the training, there are hundreds who don't. So they just have to make do with the resources they have. So even helping the providers to get training is something that would help the refugees. The next issue under medical is language barriers. That's definitely an issue. We have providers trying to make sure they talk to patients, but they have to get their own language services. They have to have someone available who they could call to provide service to the patients. So language barrier is one, I think, very important thing. If you are in the space of providing services to refugees, then you should definitely consider keeping on hand some language resource. Volunteers are paid because that is not only for medical but all areas of life that they need that handhold. Dietary change. Okay, so this one is about when a person comes to the U.S., they suddenly lose access to the type of foods they used to eat. For example, Myanmar is one of the 5 countries that is sending, that we're getting refugees from. That's an Asian country. Eating rice is a staple of the diet, and science has shown that if you grow up eating one type of carb, for example, and come into an environment like the U.S. where you don't get that carb, the other staples of diets like potatoes and pastas don't help you the same way as rice did. So rice is metabolized differently. Your body's used to it. That population comes here, they get an increased risk of cardiovascular disease or diabetes, cancer, etc. because of just not finding the food that they grew up with. And so that's something to keep in mind. Are we taking questions right now? Or,
You could. You just want to be careful.
okay. You did have your hand up?
No.
Oh, okay, all right. That's what I'm checking. All right. Dental issues is my last. It's on the handout there if you did not get it. You can pick it up later. But dental issues, especially in the Afghan wave that came, we saw that every single family had an issue with dental. So if we were to do things again, we would try to make sure we had more access to dental providers and be ready for that. And I think this is probably a characteristic of a lot of third world countries, but especially the ones where we're coming from, war situations.
All right, thank you very much. So it seems the key unique differentiators here is language and trauma between refugees and immigrants. Because I do know with immigration, at least in the home country, there's an interview usually in English language. There's some requirements to be able to get a visa and so forth. But with refugees, obviously that's not the case. And I have experience with a lot of young people trouble in school because the teachers are not trained, with trauma, handling trauma and kids. It's a big cultural shock. Plus, a lot of cases, these refugees take 6 to 8 years to get to the United States. I met once a 12-year-old, and I asked them, how long it took you to get here. He was like, since 6. So for 6 years, they're living in tents and hopping from one country to another, until they settle here. And that's obviously a lot of trauma on them. All right. From a youth perspective, the biggest challenge we see is identity. So there's an identity crisis. People are starting to, questioning who am I? Which country do I belong to? Do I fit here or not? And it manifests itself in many things. Their ability to bond with their peers. Back home, they have friends and extended families. All of a sudden, they're in a community, a different society, different culture, different way of socializing and with younger people, interacting and so forth. Besides, of course, the trauma piece we mentioned, youth in general need the ability to develop their emotional competence, behavioral competence, those kinds of things. But with refugees and immigrants specifically, the problem is a little compounded more. They face problems that typically are not presented to mainstream youth. So they need to have a little bit more of problem-solving skills, the ability to figure things out on their own sometimes. Usually, we found research has shown that when youth in schools have a problem, they typically go to their teacher first, especially if they're younger, middle school, elementary. This kid hit me, or I had a problem with that. And if the teacher's not trained or understanding, the culture, they can't provide that support. I remember working with a group of Sudanese refugees years ago, maybe 12, 15 years ago. They were 17-year-olds. Their case manager picked them up from the airport. She dropped them at some apartment complex. There's like 3 of them. They were 17 years old. And just left them on Friday and came back Monday. And for the whole weekend, they were starving. Simply they just didn't know how to turn on the stove. We actually had a fellow from Pakistan he was 25, worked with us for a year, and after maybe 9 months, you know, we were in some situation, and you know, he was there to try to use the stove, and in the middle of the conversation, he said, "I've never used a stove before until I came to the United States." He came from some small village, and they used these old kerosene, you know, devices. So these are things we take for granted. We might give them an ATM card or a prepaid card. They have no idea how to use them. So those are some of the challenges that I've come across. We'll continue to discuss a bit more. We talked about a medical perspective. Did you want to share a little bit maybe on the legal side of things?
Yeah, of course. A lot of the situations that I've seen within the legal space amongst newcomers, especially the Latino immigrants, has been work visa. You know, some of them might not have that prior knowledge that, you know, you need an authorization to work here for more or less most companies. And so, you know, they come prepared to work, but they may not be able to find a job. If you have been able to travel amongst, you know, Latino communities or immigrant communities, you may be seen at local grocery stores or 7-Elevens where many men will be there just waiting for work to come by, for somebody to provide them with labor work. So, you know, work authorization has been a big barrier in terms of helping the community, you know, especially rise up because, you know, money definitely helps buy a lot of things. Another thing would be the kind of a combination of the mental health and legal side is the reunification of families. You know, sometimes we see a lot of children who were born in their home country and parents are here, they have children, they bring their children after, you know, several legal processes that they had to go through. And the children might not know their new stepdad, they might not know their new stepmom, or they don't even know their parents. They only know them through the phone. They have no idea who their siblings are. And that definitely has been, I've seen a big barrier and like a big challenge just to kind of like mend the family, you know, help them heal. And with the legal side of, another side of the legal thing is just figuring out how can they apply for residency or a visa of some sort once they are here. You know, it's a little bit different, I would say, with the communities I've worked with, especially those of Central America that are fleeing due to gang violence. You know, it's something that is very common in El Salvador, Guatemala, and Honduras. And then we know that in South America, we see a lot of political corruption, which could be a reason why many will flee their countries. So, you know, just being able to kind of navigate, you know, and explain, you know, this is why I left, you know, and it's I need legal assistance, and then along with that comes the cost. You know, some nonprofits are great; they provide consultations, but they do not provide representation. So the fees for that is, you know, might be hard because then we come back to they don't have access to being able to work and make a living. So it's an endless cycle, and it's very hard to just navigate those resources, but nonetheless, it's an area that definitely needs more support.
Thank you. From a refugee perspective, are the same types of challenges or different?
Well, I have family law listed as number one, but asylum is definitely an issue. So I can start with that, where asylum is the process through which people have to go through if they didn't have a green card or a special visa to be here. So the unfortunate thing is that a lot of people come here and then get sent back because of Title 42. We had that in effect because of COVID, which allowed the Surgeon General to impose restrictions on refugees, immigration, due to a fear of disease. And under this statute, 2 million people were sent back. But because of the Refugee Act of 1980, we are supposed to accept refugees, and let's see, the ratio of expulsions to asylums was like 7 to 3. So for every 7 people sent back, 3 people were processed for asylum. The asylum process is very long. No one should face it without legal representation. So therefore, we've had to scramble in the nonprofit space to find lawyers to work pro bono or to work for very low cost. There's been a movement to organize asylum clinics where we have families come in and train volunteers, help them to get started on the process, and helping to create something that a lawyer can quickly look at, and then get involved in the process. We've had to create partnerships with yourself and agencies to do this. It takes a village to solve this problem. It's a really big issue, and we're still not in the clear. It would help to have the Afghan Act passed, which would automatically make these 100,000 people whoever didn't have the visa to be streamlined to becoming residents and citizens. Going back to family law, that's a big issue for the refugee population. There are women who come here and now they have a chance to leave their abuser. How should they do that? They need handled in that process. And there needs to be someone to address the stigma of divorce, because the religion may say divorce is allowed, which Islam does, but people, because they're cultural, have a stigma about it, and then don't know what their rights are. There are also issues that can happen for men as well, with custody, even in marriage itself. Like, how is it treated in these countries where these people came from? Is a marriage certificate even made? Is it filed? Is it considered a legal document, or is it just a social contract or something? I know that in Maryland, the nikah, which is a Islamic marriage contract, is considered a prenuptial, as far as I know. Anyone else can correct me, but I believe that is what it is considered here. So it's a whole process by which things need to be kind of interpreted through from one culture to over here. I think that's the main things I had on.
Okay. Can you share a little bit about the asylum process during that period? What's the status of the refugee? Are they entitled to any benefits? Are they able to work? What's their condition at that point?
Okay. If someone else is a lawyer and wants to answer that question, I can fill in some things. But they can work, have been given work authorizations. I believe they have a status of asylee applicant during that time. So they can basically be here, and they do get services and the ability to work. If you don't have your documents, then it's a problem. So we've had to, work on getting the documents. Sometimes they miss getting a work authorization card, for example. Then get involved with that.
Do these authorizations expire before they get their legal residence? Because I do remember coming across cases where they were able to work, or they got housing benefits, and then suddenly they're homeless and they can't work.
Right. Yeah. It hasn't happened yet with the population, but we are hearing these stories out of the other populations.
There's some gap.
Right, and also someone who's in the asylum process that's very tense about the other two things they've listed there, the criminal charges and civil charges that might be brought against them, are them getting involved in things. We have people who may have been attacked who don't want to file charges because they don't know how it's going to affect their asylum case, so that they don't pursue their rights. And civil issues the same way. They don't want to go through the divorce because what will happen to her case. She doesn't want to jeopardize that. So.
Okay. From a youth perspective, what we see is a lack of understanding of the law. A lot of times, the age of majority in most countries is 21, not 18. So a lot of young people don't understand how that is different here, and they still think they're kids. And then they take, certain types of infractions pretty lightly. For example, driving without a license. In their home country, it might be a minor offense, maybe no offense at all. But here you can actually face jail time. In some states, it can be pretty significant. So those are simple examples of how things, are not well understood and could cause some challenges for them. Also, the perspective of police person, a police woman or policeman. In many countries, it's a figure of oppression, and tyranny. Obviously, we have our issues in this country as well, but it's not as bad as the other places. In other places, if you get stopped by a police officer, there's a high chance that you get detained and no one knows where you are for months, maybe years as well. Here, it's a little different. So that could put people into suspicious situations, now, one other challenge I've seen, and this is even not refugees, it's an immigrant who came from Canada, but I think they had Arab origin. And the young person, he's in 11th grade, and he's unable to work over the summer. And he was presented with an internship at NASA, but because he's not a U.S. citizen, he's not able to attend. Moreover, he cannot work. International students are able to work on an F1 visa for 20 hours a week, but he can't work at all. So those are some gaps, I guess, in different laws, that affect people in different ways. All right, so maybe before we move over to opportunities, we open the floor if there are any questions about the challenges we mentioned or other things that you all have come across. Maybe a couple of minutes to take any questions. Yes?
Hi, I was just wondering about housing challenges, finding a place to live that's
Okay,
safe
housing
and
challenges.
stable.
Yeah, okay. So the question is on housing challenges, and we'll start with Jhoselyn.
You see it because I was like, oh man. I would definitely say, at least my experience working with my population has been housing's a big issue. Starting with, just understanding the groups, the Latino and immigrant population. Most of the time they might have a house, but each room is rented to a different family. So even that dynamic is complicated. I've worked with them and I've asked them, do you have a contract if you're renting a room or renting a basement? And the answer is most of the time no. And so sometimes they're not even aware of their tenant rights, regardless of legal status. They do have tenant rights, so that tends to be another barrier. And then it comes to being able to afford housing. We know that a lot of those living in Prince George's County, with the Purple Line and all of that construction happening, a lot of families are, or a lot of individuals are being essentially moved out because areas that are getting redeveloped are, going to get more expensive. So essentially, the cost of living has definitely risen, and then housing resources, like housing rental assistance and so forth, is very limited, even for citizens, let alone for those who might not have limitations or have limited, they might be resident or just visa holder. Housing is a big thing. I can definitely tell you that with COVID as a community health worker and case manager, it was very difficult, even though a lot of nonprofits were giving some $1,000 of assistance or whatever it was. It still was not enough because many couldn't, pay rent. And then it's like we have all these utility programs, but they might not be able to apply because maybe if the person who's renting out the space or the house does not want to apply because, their name is on the contract. So how do you help somebody with utility assistance who's renting a basement? And so there's a lot of different barriers that I've seen regarding housing, from, limited funding to even financially help somebody with housing, and then just finding places where to live that is affordable. And then it comes always back to that income, if they are able to afford things. And then that's where we overlap with a lot of domestic violence, sexual abuse, because you're living with strangers sometimes, or people you don't know, and that, or let's say you have individuals who might not be paying rent, then that just puts the whole household or apartment complex, so those renting that apartment, at risk of eviction. So that definitely would be my experience. So that is an area I'm still trying to kind of figure out and navigate for my community, but I'd love to hear from everybody else.
Well, Jhoselyn, you said a lot of the things that are so important for the refugee population. One thing that I guess would be different is that when the refugees first come, they don't have a choice as to where they can So they get settled in housing which they didn't choose, and unfortunately can be subpar at times based on what the resettlement agency is able to find. And so then refugees also don't know their rights as tenants. They don't know how to address the issues if they're having issues with living, and they also do not afford to move out from where they are. They even have trouble affording where they are, because now we're starting to hear a lot about eviction notices being given for the refugees who have been resettled recently. They just have not been able to build up their income. They're getting jobs that are $11 an hour. That's not enough. Another problem is within the refugee population that is here now. There's a lot of children, a lot of people within the household to be supported. Even finding a house big enough sometimes is an issue if you have 11 kids, 5 kids even. Between 5 and 13 is like the range for now and down. So that has been an issue as well.
All right, thank you very much. One issue I've noticed is transportation as well. So sometimes when they're settled in certain places, there's not a bus route, it's hard to get in and out. Right, any other questions related to challenges? Yes.
We work for IRC, so we do have a lot of similar challenges, and I was wondering if you guys are facing delay, particularly to the refugee population, in receiving medical insurance. If so, how do you guys work around or combat the issue?
But not everyone had that issue, but we dealt with it as case by case basis. And it took a lot of talking, a lot of calling around, finding out what we could do, and going back to IRC, and we're really thankful when we find, helpful people there. So we've been going back and forth on issues. Unfortunately, those who have these issues, they tend to go into debt on the medical. We can find them a provider, but then, they can't pay. So it has been challenging, and there has been some delay for some cases, but it's not for everybody. So that's the good news.
All right, thank you.
So, my question, you mentioned that you feel the providers to understand and differentiate between the anxiety and the real medical issue. I think it's very challenging because the providers, they don't have time for trainings and spend time to address this issue. So how you solve that problem?
That's a good question, and I wish I had the answer. So I think that we just have to continue to have a conversation where we're talking to providers about what needs to be done. So however we can send that message to whether it's to professional societies, perhaps there can be some encouragement. If they have to do CME hours, for example, maybe we can have more sessions that are geared towards the refugee and adult population.
And what we do in our organization, we try to train some medical students at Johns Hopkins to how to deal with the refugees and assign them with different patients, like they are asylee or refugee. And that's really helpful because they work with providers, and that's helped them to just like sometimes to be the voice for the client. So
I think also, especially with refugees, we have to assume that refugees have trauma. That's the norm, right? That's the default. They have, post traumas, disorder. With immigrants, there's also identity issues, right? And there's culture, issues and culture barriers and shocks and so forth. So all of those, at the end of the day, summon to, aggregate to some mental discomfort. Even if you don't want to label it as a disorder, there's some, it's less than perfect. So whoever's dealing with this population needs to keep that in mind, whether it's a physician, a teacher, social worker, whatever. And it could be, it's so vast. It could be cultural differences in the way you fill out a form, or you just talk to the representative in front of you, right? People in different cultures represent things differently. So it could be, so across the board. The way you're assigning homework in the classroom, or you're asking people for feedback as a teacher, that could put a lot of stress on someone who's not from this country, and so on. So it's an ongoing progressive process, that just has to develop. And anyone working with an immigrant or a refugee has got to, keep that in mind. Anything you wanted to add?
Well, I'll let you ask the question.
I had a question. So, Jhoselyn, you mentioned earlier about reunification of families and everything. What are the resources that we have in Baltimore County or Baltimore City that assist youths, teenagers that are facing those problems?
So I'm not able to share too much about Baltimore County because I'm more in Montgomery and Prince George's County, but what I've seen similar, like in terms of like process, kind of ties into the previous conversation was, my experience working with uninsured youth, for example. Certain counties have different programs, and sometimes that could be great, and sometimes it could be, district. For example, Montgomery County, they have Care for Kids and maternity partnership where if you're undocumented, you can apply and you would get accepted within 2 weeks. I usually can submit the application for them via email, super easy. I go over to Prince George's County, it's a whole different ballgame. There is no prenatal care service or program for those who are uninsured or undocumented. So they have to pay out of pocket for prenatal care. So most of them might opt out and not even do that. And that's not even including if they're late term. And then we have Kaiser Care for Kids. So it's similar to the Care for Kids in Montgomery County, but it's partnered with Kaiser Permanente, but it's limited. So for example, Montgomery County, for both programs and including Montgomery Cares, which is just for adults in general, there's no limit or no cap on the number of people who can join a year. But in Prince George's County, if we're looking at Kaiser Care for Kids for children who are undocumented or have essentially no social security or some type of access to be able to apply for insurance, they apply for Kaiser Care for Kids, but Kaiser Care for Kids only accepts 400 applicants a year. Mm-hmm. In one elementary school, there can be 600 students. So what happens is usually, I tell them, okay, we gotta go put you on the wait list. From there, wow, that's processing. Most likely you're not going to get approved this year, realistically. Maybe next year, hopefully. But let's get you connected to a community clinic. Then we come into the barrier of, not getting appointments soon enough. So we try to, I always try to tell them, okay, let's schedule it, especially if no one's sick at home right now. Let's schedule it ahead of time because it's going to be a lot harder when everybody's sick. So that's essentially kind of step 2. Step 3 is what health fairs are available right now that are providing. And so that's kind of been the process I've been working with. So similar, I would imagine, in Baltimore County. I'm not too familiar with what's accessible for those with, who are undocumented, what the programs are, but nonetheless, that might be a strategy that you can implement with the resources that are available. Hopefully, I answered your question.
Yeah, for Baltimore County, the Mayor's Office, of course, at MIMA is a great place to start. They're well connected with a lot of organizations. They have WhatsApp groups, so they're really great at facilitating, really for different organizations to connect. One thing we see with youth is access. That's a big challenge, Getting to the youth, usually they go to school, right? So if you want to reach them, you need to reach the school system. And typically, school systems across the board are very closed entities. They don't interact with the outside world too much. So that's the challenge we face, right? But there are a lot of programs out there: mentoring programs, coaching, developmental programs, tutoring, all kinds of things. But sometimes the students, the youth, do not know about it because, again, access is difficult. Some ways is to partner with local your council representative, for example, the city or the county. Your state delegate, could be another resource because they might know these organizations, can facilitate, connections, and things like that. All right, so let's switch over to opportunities. Maybe we'll start again from the medical perspective with immigrants and refugees. What are some of the opportunities you've seen?
I guess I'll highlight one specifically, just because it's no pun intended, but my baby and has to do with babies. But it's the Healthy Babies Equity Act that is going to take place, or I guess because it begin July 1st, so we're about a month away. For those essentially who cannot qualify for Medicaid during their pregnancy due to legal status, but may have qualified for, with the other requirements. But because of that legal status, they will not be able to qualify for that. So we do expect a kind of like, I guess you could think of it like a backorder. We're going to have a bit of a lot of people applying for prenatal care services. Coverage is going to cover their prenatal care, some of the postpartum, and everything that comes with that. What we also know is that, that's not just Latinos, that might be a stigma that or perspective some might have. It's essentially going to service all immigrants. Latinos just are one of the groups. So I definitely think that that's one great opportunity. I've worked closely with the Maryland Latino Legislative Caucus, who actually some of them are here in terms of representatives to talk more about that. But through my organization, our goal is to kind of bring more of that education once it's up and going, how you access. But we do know that there are going to be some barriers, just like to anything that is new. There's going to be some kinks to it, including just providers willing to take patients again who are in their late-term pregnancy. But nonetheless, it is an exciting opportunity, and just being aware that, again, how I mentioned, each county has a different program. I can definitely say that with Montgomery County, for those who are undocumented, they can apply for Montgomery Cares. So essentially, if they live in Montgomery County, are low income, can apply, and that would get them the basic primary and preventative care services at low cost, and their copay might be like $30 per appointment, $15, a lot better than like $300, $400, and $500 if they had no assistance. But unfortunately, that program does not exist in all the counties that have immigrants. But nonetheless, I did want to just share about this new exciting opportunity for those in the maternal health space.
So what's the name of the program?
Healthy Babies Equity Act. Yeah. Yes.
Is it only Montgomery? I think only Montgomery in the state of Maryland provides insurance to undocumented individuals.
Yeah.
So no other counties in Maryland.
Unfortunately.
Unfortunately. Okay.
Yeah, so I always say opt out to just kind of look into your community clinics and see what's going on.
But this act is statewide.
Yes, statewide.
All right, from a refugee perspective.
So opportunities. I interpreted this question completely differently. So I'll switch gears. I was going to mention that how refugees bring us new knowledge and healthy appreciation of what we have here in America and the stronger society as well as join us and integrate. But what I could speak to is that we have an opportunity here for from my community, the Muslim community, which is that we have like 9 government agencies right now. If you notice, some of them come from faith backgrounds. We have Lutheran, we have Catholic, we have Church World, even the Hebrew Aid Society. So it is an American tradition that communities come forward and start to take care of their own. We have that basic faith principle as well. And what we experienced in the past year or so is Muslim organizations coming forward and starting to contribute to refugee settlement and immigrant care. So we had a coalition. There were 25 Muslim mosques and nonprofits in Maryland that came together during the crisis when people were being housed in hotels and on military bases. Then from that, they followed the population into wherever they were resettled in community. Therefore, and we are, I believe there's 2 Islamic organizations who either have, they're pursuing or they've received resettlement agency status. So that is also a positive thing. The question might come to your mind, where were we before this? The only thing I can say is we're young. We just got here. I'm a parent of immigrants, and my co-panelists represent immigrants, right? Who are yourselves people who arrived here, gotten here, and then that's the kind. Those are the kind of I work with within the Muslim community. A young community that is just now getting onto its feet in terms of being able to support others. So that's the opportunity that comes.
All right, thank you for sharing that. So from a youth perspective, like Nasima was saying, definitely they bring a lot of appreciation for the educational system here. We find that with young people, once the language barrier is resolved, they excel really fast in school. A lot of them also have entrepreneurial, interests and abilities, so they take initiative. And usually, because of the trauma they've been through with refugees, they're pretty, steadfast and they have strong grit to, try different things and fail at it until they succeed. Show of hands, how many here know Steve Jobs was an immigrant? Yeah, he was from Syria. I didn't know that until very recently after he passed away. Actually, I was reading his bio, but he came from Syria, right? And I was reading about Dearborn, Michigan. Why are there a lot of Arabs there? And it turns out Ford, when he started Ford Motors, he was looking for a very specific skill set. People who are meticulous in their work. They don't cut corners and they're very patient. And he found that the Arab population in Syria and Lebanon at the time fit that profile, and that's we started hiring people from over there. That's why you have a big population there. So, like as I was saying, obviously it brings strength to our society at large. Also, immigrants and refugees in general have strong tendencies to be engaged in their communities because they come here, they find themselves, sort of starting from scratch, no friends, no social lives. They have to congregate and start something. They're more forced to be part of something. In my interactions with young people from the immigrant and refugee population, we found also they have a lot of leadership skills. They're courageous. They stand up and speak for themselves and so forth. And they have a very high level of gratitude for things that we take for granted. Again, another funny story. This gentleman from Pakistan, when he came here, he was working in middle school in this country, and they were so big on trading, shoes, sneaker shoes, Nikes and Jordans and whatnot. And he was like puzzled. He's like, in my country, a shoe is a very, very trivial thing, but you guys give it such a big status in this country. So it took him a while to understand the dynamics of it. But those are some of the opportunities we've seen, and of course, culture of diversity, appreciation for differences in this population. So we have about a couple of minutes. If there are any last minute questions, also you can scan this QR code to stay in touch. We do have a few WhatsApp groups that we run, and we're very active in information. Yes, ma'am.
I'm just curious if any of you see any opportunities to coalesce across marginalized groups, period. So obviously immigrants are one of those groups, and a lot of the time I feel like we're siloed right into, okay, this is an immigration thing or this is an immigrant refugee thing versus a total access thing for other marginalized groups that are citizens in the United States. And I'm curious if there are, or if you've seen any opportunities where those coalitions can kind of form and take mass demand more from the US.
I can take a stab at that. So, Islamic missions to the organizations that are good. We have a few programs in the city which mostly serve people of color, so Black young people, some immigrants, a few refugees as well. And to your point, it does bring those marginalized groups together where they start to relate to each other's challenges and also identify their strengths as a collective group. So there are some efforts like that, and it does help broaden the perspective and then also develop more sustainable solutions. So for example, what we face problem is transportation. Even like you said, for residents in Baltimore City who've been living there for decades, they just can't get to us, even though there are bus routes right in front of the building. But it takes 2 hours to get from East Baltimore to where we're at, right? So who's 60-year-old is going to spend 2 hours each way? That's a lot of time. So, there are ways around it, doing shuttles and things like that, but that's one way. Events like this, right? So, although it's about immigrants and refugees, or immigration specifically, these are common problems. I know my parents, they're US citizens, but they've been living abroad for back in Egypt for quite a while. And they came last year, they were thinking of settling, but they spent 2.5 months just to figure out how to get health insurance, right? And they're citizens, they're living with me, really it's comfortable for them. And at the end they said, this is too much. And when they got to the point that they were accepted, they actually taken money from me. They were bankrupt. Like the cost was more than actually the social security they were getting. They said, no, this is too much for us. So there's definitely a lot of commonality. And to your point, I think it's actually important to help solve those problems. Yes.
Speaking of like yes, definitely have had issues with mothers. The things that we have, first of all, a lot of discussion, and actually our volunteers and guidance. This is what we need to do for you guys. You have to hustle, you have to advocate. Yeah, I think so, because we also try to build partnerships with different programs we find. For example, I found the ILIA, they have I they will give a team of people that will person me. They are hoping to help us with the cases.
Last question. Well, thank you very much. All the best.
Thank you, everybody.